Did you know that nearly 90% of new mothers experience nipple discomfort while breastfeeding? Let's explore how to avoid it. Nipple care while breastfeeding is easier than you think, and I've got the tips that will make your experience so much more comfortable. A cracked nipple, also known as nipple fissure or nipple trauma, is a common breastfeeding problem characterized by painful cracks or small lacerations in the skin of the nipple. What causes nipple pain? Improper latch, poor attachment of the baby to the breast, can result in cracked nipples. This causes shallow suctions on the nipple, leading to nipple trauma. Please check my previous video on how to breastfeed for tips on how to latch properly. Oral thrush. Thrush, a yeast infection, can cause nipple pain and is often associated with cracked or damaged nipples. It can be passed between the mother and baby during breastfeeding. First-time moms, while it is not always the case, almost 90% of new moms experience nipple pain during breastfeeding, especially during the first few days. The increased suction and saliva can result in sore nipples. Personal care practices, using soap, shampoo, or other harsh products on the nipples, can dry them out, leading to soreness and cracking. Tight bras and trapped moisture can also contribute to nipple soreness. Breast engorgement. Breast engorgement is also a common breastfeeding problem. Engorged breasts can make it difficult for the baby to latch properly, increasing the risk of nipple trauma. Incorrect use of breast pumps. Incorrect use of breast pumps, such as using a flange that is too small, can also cause nipple cracking. Signs and symptoms of cracked nipples: nipple pain and soreness. Severe pain during breastfeeding, which can be a disincentive for continued breastfeeding. Dry and flaky skin around the nipples. Bleeding on the nipple cracks. Complications of cracked nipples. Cracked nipples can increase the risk of infections such as mastitis and thrush. In cases of bleeding nipples, there is a risk of transmitting blood-borne diseases like HIV, although this risk is generally low. Tips on how to prevent and treat cracked nipples. Ensuring the baby latches correctly is key to preventing nipple trauma. See video on how to breastfeed for proper latching. Regular breast and nipple care is essential. Only wash your breasts and nipples with water. Avoid using soap or shampoo, as these can remove natural lubrication and cause dryness. After each feeding, let your nipples air dry naturally for 10 to 15 minutes. You can also gently pat them dry with a towel. Apply a few drops of breast milk to your nipples after feeding to help moisturize and protect them. Wear comfortable clothes. Wear a clean, well-fitting bra with good support. Cotton bras are recommended as they allow air to circulate and help keep the nipples dry. Avoid bras that are too tight, as they can put pressure on the nipples and cause discomfort. Change breast pads frequently. If using breast pads, change them often to prevent trapped moisture, which can lead to thrush and other infections. Cool compresses can help soothe sore nipples by reducing swelling. You can use a cool compress on your breast and nipple as well as under your arm. Use over-the-counter nipple creams. Use 100% pure lanolin cream with a cotton swab after feeding. Lanolin is safe for babies and can help soothe and heal sore nipples. Did you know you can also apply your breast milk after every feeding? Breast milk acts as a moisturizer. If the pain is severe, you can take over-the-counter medications like acetaminophen or ibuprofen. Nipple shields can be used as a last resort if the baby has a condition affecting their latch, such as being premature or having a tongue tie, or if you have a short or inverted nipple. However, they should be used for short-term periods only, as they can affect milk supply and the amount of milk the baby receives. For treatment of oral thrush, consult a doctor for proper treatment. Allow your baby to end feeding. Let the baby determine the end of the feeding. Removing the baby from the breast without breaking the suction can be painful and cause damage to sensitive breast tissue. Consult a lactation consultant to evaluate the baby's latch and provide guidance on proper breastfeeding techniques. Please subscribe, like, and share.